A 55-year-old woman found confused and obtunded state is rushed to the nearby hospital. The daughter informs the emergency department physician that her mother is generally healthy woman who sees a psychiatrist over 2 weeks for long-standing depression. She has been on the same antidepressant for many years. On physical examination, the patient responds incoherently to the pain stimulus, that what we call as hyperalgesia. The pulse rate is pretty high, the blood pressure is pretty low, and the temperature is high. Skin is warm and flushed, pupils are dilated, and no bowel sound can be heard. The patient's electrocardiograph is shown in this particular image. The physician suspects an overdose of her antidepressant. What is the most likely mechanism of action of this patient's antidepressant medication? As it blockage of the dopamine receptor within the central nervous system, blocked of the reuptake of the dopamine within the central nervous system, block of reuptake of norepinephrine and serotonin within the central nervous system, or blockage or enhancement of the release of norepinephrine and serotonin. So everything is given in this particular question, and it's a pretty easy question. If you talk about the antidepressant medication, there are two main class of the antidepressant medication. That is the selective serotonin reuptake inhibitors and the tricyclic antidepressant medication. If we talk about the side effect of the selective serotonin reuptake inhibitor, that is mainly the sexual dysfunction. And if we talk about the tricyclic acid antidepressant medication, then it has a anticholinergic side effects mainly, and it also causes ventricular arrhythmia, and is shown in this particular image that the patient also having arrhythmia of the ventricles, and thus this one is. So if we see the mechanism of action of the tricyclic antidepressant medication, that it not only inhibit the reuptake of the norepinephrine, it not only inhibit the reuptake of serotonin, rather it also block the M receptors. So once the M receptors, that is the muscarinic receptors, they are blocked, the acetylcholine cannot act on the receptor. So once acetylcholine cannot act, then definitely there is activation of the anticholinergic system, that acetylcholine is not working. So all the signs which can we see in this question, for example, like the skin is warm and flushed, there is a dilation of the blood vessels, the pupil are dilated due to anticholinergic effect, there is a no bowel sound, that the bowel is not properly uh, contracting due to the lack of cholinergic system, and due to the over activation of the anticholinergic mechanism due to the overdose of this tricyclic antidepressant medication. So in this particular image, everything is given that the patient is suffering from the overdose of tricyclic antidepressant medication, and the side effects or anticholinergic side effects, and the mechanism of action of the tricyclic antidepressant medication is that it not only inhibit the blockage of the serotonin, also the norepinephrine. So the option C is pretty seems to the action of the tricyclic antidepressant, that it block the reuptake of the norepinephrine and serotonin within the central nervous system. So the correct option is the option C. So what about the option A? Option A is mainly the action of the antipsychotic medications like haloperidol and fluphenazine, clozapine. These are the medications which block the dopamine receptor in the central nervous system. And what about the option B? Option B is the mechanism of action of the bupropion and methylphenidates. These are the medications which inhibit the reuptake of dopamine in the central nervous system. And option D is the enhancement of the release of norepinephrine and serotonin, and this is done by blocking the alpha 2 receptor present on the presynaptic membrane, and the action of this is done by antidepressant medication like mirtazapine. Mirtazapine is also an antidepressant medication that act on the alpha 2 receptors and block the alpha 2. Once the alpha 2 is blocked, there is no inhibition of the release of neurotransmitters, and once there is no inhibition, definitely there is increase or enhancement in the release of norepinephrine and serotonin. So the correct option is C, and the patient is suffering from the overdose. So what should be the treatment and how we can treat this patient who is suffering from the overdose of the drug? So for the tricyclic antidepressant overdose, the treatment is by administration of the sodium bicarbonate. So by giving sodium bicarbonate, we can decrease the effect of the overdose of this medication. So thank you very much for listening.